Hi, I'm TK with Be Well PBC. The Palm Health Foundation Healthier Together Communities and my fellow community connectors recently invited two local physicians, Dr. Michael Smith and Dr. Tiffany McCalla, from the Leroy Jefferson Medical Society to join us for a couch conversation to talk about COVID-19. We appreciate the doctors giving us straight talk about COVID-19 and how we can all stay safe. This is the fourth in a series of 4 videos discussing what you need to know about COVID-19. In this video, you will learn the facts about getting infected. Get ready to learn more about COVID-19 and be sure to watch the other videos in this series. You can find the series on Be Well PBC's or Palm Health's YouTube channel.
Like, have they started doing research on the people who don't have symptoms yet? Because I just want to know, like, is it a blood thing? You know, do I need a transfusion? Like, I mean, okay. what do they got that I don't got? Because I want to have what they got.
No, it's not like that at all. As I said earlier, everyone has a different biology. Everyone has a slightly different genetic makeup, okay? We are still learning about our genetics, okay? We are still learning about, you know, how those base pairs work and come together. And as Dr. McCalla indicated, the research is ongoing. Years from now, we're gonna look back. That will be a retrospective study and we're gonna know more. Americans are very spoiled kids in that we want everything right now, right away. And that is not how life works. That's not how science works. Trust me, we are working, trying to discover and get these answers as quickly as possible. I got several colleagues in the College of Medicine who are upstairs in those labs doing all kinds of things, all right? Everyone around the world is trying to come up with answers. But to respond to the question, everyone has a unique, different biology. There are people, in my earlier training, I was obsessed with the Ebola virus. Please don't ask me why, that's something weird about me, but diseases and things that nature have always fascinated me. But I was fascinated in my earlier training about the Ebola virus. And for those of you who know about the Ebola virus, it's a hemorrhagic fever, okay? Meaning that it causes you to hemorrhage and bleed out. And it's the worst of the hemorrhagic fevers. There are many different kinds, but the Ebola is the worst form of it. Well, where it was discovered in the parts of Western Africa, in these very remote and primitive villages, there are villages where the whole village, or almost the entire village, would be dead from the Ebola virus. And when people found out that that village had Ebola, they stayed away, okay? they social distance. But the amazing thing is that there oftentimes were survivors, people who survived the infection of Ebola with no modern medicine. Their bodies just, for whatever reason, was able to withstand it. And that's just the case with human biology. Who knows what variables exist within your genetic makeup that allow you to get a mild version and someone else to get a severe version? Or it may not even be about a mild version or a severe version. It may be that your body responds differently than others. You know, why do young people develop COVID-19 at a less rate than adults? We still are trying to figure that out. Okay, so your questions are absolutely valid, but we just don't know yet. Folks, understand this. We discovered COVID-19 in late December of 2019, okay? It's March 2021, okay? So we've been living with this virus for a little over a year, okay? And by fascinating work of our scientists, we already have vaccines. We don't even have a vaccine for HIV yet, okay? And that's been out since the 80s. So this is amazing progress for the science community, but even as fast as amazing as it is, we still don't have, we have to be patient with the research. But we want answers to these questions just as bad as you do.
And I think this is gonna require more research as well. My mother got COVID at 92. She survived it, COVID, but ultimately she passed away from a heart failure.
Death, this is where some people disagree. So there are deaths related to COVID, meaning you got sick, you got a fever, you coughed, you ended up with pulmonary failure, and you died from COVID-19, right? And then there are deaths related to COVID, meaning you got COVID, you got sick, you got a little better, but then you got multiple pulmonary embolisms and died, or you had a heart attack and died, or you had a stroke and died, or you had, myocarditis and died. It went back to the fact that you had COVID, right? So you have these side effects related to the COVID virus itself that unfortunately increase mortality. And so that's what becomes so difficult in terms of differentiating between what is a COVID death versus what is a COVID death or a COVID related death. So
It
again,
seems like a lot of people who got sick with the virus are still struggling with lingering effects. Do they eventually go away? After how long?
Oh yeah, yeah. That's a big discussion in the science and medical community. They're referring to it as the COVID-19 effect, and that's people who long after getting over COVID-19 still having health complications and residual problems. That all falls into the realm of ongoing research. We don't know why these things are happening. We don't know what the specific cause is. As I said, folks, we are in the infantile stages of learning about this virus and how it responds to these vaccines. We are in the earliest stages, that the answer to that question may come out 5, 10, 15, 20 years from now, or it may come out, in a year. I don't know. We don't know that yet, but it is a concern. There are a number of reports from around the nation of people, after having COVID-19, still experiencing some pretty significant complications.
Question. Dr. Smith may have answered this. I apologize. I was having some technical difficulties, but I know a few people who have had COVID before, and it makes you very paranoid that you may catch it again. Is there any data showing how likely you are to have it a second time around or a third time?
Yes, Dr. McCalla kind of touched on this earlier. The jury is still out as to why some people, even after having COVID-19, contracted again. We tend to think that when you have a viral disease, that you oftentimes develop an immunity. We're all familiar with chickenpox. Usually, once you have chickenpox as a child, you don't get it again. But there are some people who do in their older age, and they develop shingles, a more severe form of it. It just goes back into the comments that I made earlier, is that we all have different biology, and there's still a lot to learn. We don't really have clear answers as to why, people contracted again. Sometimes people who usually, when you develop a disease, you have a pretty strong immune response. You typically have really good antibodies. But for people who just contract COVID-19, sometimes they have pretty good antibody response, sometimes they don't. And that's why people who have contracted COVID-19, once they've gone through their process and after a period of time, they are still encouraged to get the vaccine to increase, their antibody response. But it's not clear right now why some people still develop COVID-19 afterward. That's why we continue. The prevailing message in all that we've said this evening is for people to continue to be careful and to adhere to the recommendations of social distancing, wearing your mask and washing your hands. It all goes back to the most basic things that everyone has the power to do, okay?
Right.
I mean, if you are not around the disease, you can't catch the disease, okay?
Mhm.
And I've told family and friends, listen, if I don't do it, you shouldn't do it, okay?
Mhm.
So, you know, I have classmates from high school and college and all around, you know, sending messages and asking questions, you know, and I answer it right away. But, you know, the basic thing is, you know, until we know more, you have to be responsible for yourself. You have to be responsible for your own health. Okay, you can't blame it on the government. You can't blame it on this and that. You know the basic information. Wear your mask, stay away from other folks, and keep your, you know, and wash your hands as much as you can. So if you know, until we know more, you know, just protect yourself, and you know, and let's do our part to get on the other side of this pandemic.
Thank you.
Can you speak about monoclonal antibody therapy? And that came from social media.
Monoclonal antibodies are antibodies that are created in the lab, okay? They are man-made antibodies that mimic your body's immune response. So when we spoke earlier about, you know, the body's immune response, we've always had the ability to synthesize certain antibodies in the lab that elicit the response that you would get from natural antibodies. So the name sounds more sciencey than what it really is, but it's really pretty simple. But if Dr. McCalla wants to cut back in.
So essentially the monoclonal antibodies they basically create an antibody to the spike protein of the COVID vaccine. So remember, we talked about the way the vaccine looks, it's a circle with these little spikes. So like what Dr. Smith was saying, monoclonal antibodies aren't new. We've used monoclonal antibodies for multiple different things, but in terms of COVID, the monoclonal antibody creates an antibody to the spike. So if the spike, you know, and the way that we use it is for someone who has a positive COVID-19 test, all right? So scenario, you've gone out to a restaurant or Publix or your doctor's office or wherever, and you contracted COVID-19, okay? And you're at day 2 or 3 and you're like, oh my gosh, I have COVID. Now you have a fever and you feel terrible. If you're like a young, healthy person, you're not a candidate for monoclonal antibody, the way that we use it. However, if you are an older person or have multiple comorbid risk factors that would make you more likely to have severe disease, you're a person that should consider monoclonal antibodies. Why? Monoclonal antibodies essentially almost acts like you had the vaccine, so you develop a better immune response. You're developing an antibody response to the virus without having to go all the way down the rabbit hole and get really, really sick to do it. It's only good before you get really, really sick. So why we make a big deal out of this? If you get a COVID-19 diagnosis on Monday and you start feeling a little crappy Wednesday, Thursday, you can get monoclonal antibody. However, if you wait till Friday, Saturday, or Sunday and you feel really, really crappy and you have to go to the ER and you require oxygen, you are no longer a candidate for monoclonal antibody. The point of the monoclonal antibody is to prevent severe infection. So if you are a high-risk person, meaning that if you risk stratify, you have hypertension or diabetes, or you're obese, or you have lung disease, right? So all these things. So you're someone that if you get the virus, you may not do well. You get the monoclonal antibody early to help prevent hospitalization. It reduces the risk of hospitalization by like 70%. So it's actually a really big deal. And we try to, you know, every time I speak, I try to talk about it, make sure people know about it, because people aren't talking about it. You're not hearing about it. And it's actually in Palm Beach County only available, I think even still at Bethesda East, Bethesda West, Wellington Hospital, and through Dr. Yemi Osiami, who is an infectious disease specialist. Those are the places that it's available outpatient. I think Jupiter also has some, but you have to have a relationship with a doctor there. So.
Thank you for joining us. Let's talk COVID-19. For more information, please be sure to watch the other videos in this series. and visit the T. Leroy Jefferson Medical Society website.